Of you have a lot of questions about this pandemic right now. We do want to bring in NBC News Chief Medical Correspondent Dr. Torres to answer some of them. Thank you so much for being with us tonight. Mayor de Blasio just announced new guidance. He's asking people to wear what he referred to as a face covering when they go outside to reduce the risk of transmission from people who don't have symptoms. John, he's asking people to leave the masks to the medical workers and use a scarf or a bandana. Is a homemade mask like the mayor described even effective?
And so I think universally all the experts are saying the same thing. Let's leave surgical masks and N95s to healthcare workers and frontline workers because they have to get in people's faces, and those people could have coronavirus and could be spreading it to them. So it's important that they have those devices. But for the rest of us, they're talking about scarves, handkerchiefs, cloth-type masks that we have around our house or can make around our house. The truth is behind those do offer a little bit of protection, not as much as an N95, but they will offer you protection. And the thought idea behind here is that you're not necessarily doing the things you need to do. You're not doing that 6-foot separation. People out there can give it to you even though they don't have symptoms, because this is one of the kind of quirky things about coronavirus that can happen. And so they're saying, let's do this. Let's cover up our nose and our mouth for when we're out and about, just to make sure we don't get it. But probably even more importantly, if we happen to be one of those ones that has it but doesn't know it, we're not spreading it to anybody else. And so again, those cloth face masks, those scarves, those types of coverings can certainly help. It's essentially the equivalent of covering up when you cough or sneeze, and we're asking them to do the same thing here, but doing it on a regular basis.
I'd like to ask you to look into the future for a minute here. There are different estimates as to when we may see the apex. Could be 7 to 30 days from now, but we're already hearing worries about a potential second round of COVID-19 in the fall. Do you have any predictions about whether that's something we could be looking at again after we think the worst of it is over?
So what you're seeing here is a couple things. One is, when the apex is going to happen here, and that's going to be determined on how well, not just here in New York, but how well the nation follows those guidelines, keeps that separation, keeps staying at home in order, because then we don't spread it. But as far as coming back in the fall, I think just about every expert is saying, yeah, we think this is going to turn seasonal. We think it'll come back in the fall, and we need to be ready for it so we can start doing those things early on. I think the new normal going forward, at least for the next year or two, are going to be some of the things we're doing now, which is the social distancing, not gathering in large groups, especially as we start getting towards the end of the summer, because we want to gear up for what's going to happen in the fall when it does come back. We're better prepared for it. We have more tests that we can use for it. By then, hopefully, we should have medicines that can help. And the vaccine around the corner, because they're talking about 12 months, which would put it in April of next year. That's going to be the big game changer.
Right, and we certainly don't want people to get complacent. I know we don't have much time, but I did want to ask you one other question about long-term care facilities. This has been a big issue in New Jersey, with 1/3 of those facilities in the state reporting at least one case. What would you say, Dr. Torres, to families who may be thinking of bringing a loved one home, but someone who may already be medically fragile?
And that's the main thing. How medically fragile are they, and what would the transportation and the changing environment do to them compared to what's going on at the long-term facility they're at? So I take a hard look at the facility, seeing if they're doing the right things to keep it clean, keep visitors out of there, keep the members there protected. And if you're a little bit questionable, you don't know what's going on, certainly talk to them. If you still have questions and you think about moving them, make sure you talk to them about how you want to move them in a right fashion, because you can't just put them in a car and bring them home. You have to make sure that they're okay to do that, that when they get home, they're in a different environment, well taken care of. They're very fragile. They're at highest risk of developing complications from this, so they should be isolated if they're at home as well. So just make sure you have everything set up. Don't just knee-jerk react, pull them out, but check both sides to see which is best for the person.
Well, Dr. Torres, we always appreciate your time and your expertise. Thank you so much for joining us tonight.